Hi, I'm Dr. Thomas Gerber again, the web and social media editor at Mayo Clinic Proceedings. I'm also a professor of medicine and radiology at the Mayo Clinic College of Medicine. So we've worked some lately on our online video content. Did you notice our new video segment intros? What do you think? If you know what music is playing before the author videos that we're now calling Insights, why don't you let us know on Facebook? I'm really curious. But don't try to guess the new theme music for this issue summary segment. It's an original that was composed just for us. But now for the Editor's Choice and Highlights articles in the May 2015 issue of Mayo Clinic Proceedings. Our Editor's Choice original article this month comes from the Rochester Epidemiology Project and was authored by Dr. Daniel Dudenkov and colleagues from Mayo Clinic here in Rochester. They examined the incidence trend of 25-hydroxyvitamin D values above 50 nanograms per milliliter from 2002 to 2011 and their association with hypercalcemia as a marker of vitamin D toxicity. This article provides interesting information on the effects that increasing awareness of vitamin D deficiency in recent years has had on vitamin D supplement use by the general population. This information once again drives home how important it is that healthcare providers ask about the doses of non-prescription supplements that their patients use. One of the highlights in our May 2015 issue is a population surveillance study from here in Olmsted County, authored by Dr. Sheila Mainman and colleagues from Mayo Clinic and from several international healthcare institutions. Read this article to learn about the incidence and recent temporal trends of acute coronary syndromes. You will also find out from this work whether survival after an acute coronary syndrome has changed over time and whether survival differs by type of acute coronary syndrome. Another highlight in this month's issue is a review for the primary care physician on drug management in elderly adults with chronic kidney disease, authored by Dr. Claudio Ponticelli and colleagues from the Humanitas Clinical Research Center in Milan, Italy, and the University College of Los Angeles in California. The authors address a vexing issue because, as you know, many factors conspire to make older patients with kidney disease particularly susceptible to the risk of adverse drug reactions. On the other hand, planning pharmacological management in these patients is made difficult by how little information there is on the pharmacokinetic and pharmacodynamic profiles in these patients for many of the drugs that we commonly use every day. You'll appreciate the author's recommendations on how to reduce the risk of adverse drug reactions that they have based on an exhaustive literature review. As always, online access to these Editor's Choice and Highlights articles is free during this month of May 2015. You can find more information on our Mayo Clinic Proceedings website. Don't forget to friend us on Facebook, follow us on Twitter, and subscribe to our YouTube channel. More information on that at the end of this video in Dr. William Lanier's gentle Southern accent. I hope you'll tune in again when it's time to talk about the June 2015 issue in just a few weeks. Thank you for listening.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.